Good afternoon. And welcome to the third program of the 2025-26 season. I'm Kevin Haggerty, Vice Chair of the Marin Coalition. I'm filling in for Scott Pinsky, our chair, who's traveling. I hope you were able to attend and enjoy our September program with Dick Spotswood and our October program featuring San Francisco columnist Joe Berfoli. I think you will find this month's program featuring former Marin County Health Officer Matt Willis informative and thought-provoking. Before I introduce Dr. Willis, I want to tell you about our next few programs. Have you ever wondered who decides how our local districts, cities, and service agencies are formed and why some get consolidated and others don't? Our December 11th guest speaker will be Jason Freed, Executive Officer of the Marin County Formation Commission, otherwise known as LAFCO. Learn how LAFCO promotes efficient local government, oversees boundary changes, and helps shape the future of public services within Marin County. In January, we will host a program entitled Human Trafficking in Marin County, Hidden in Plain Sight. This program is co-sponsored by the League of Women Voters of Marin County and the Marin County District Attorney's Office, and will feature a panel discussing this important issue. The program was originally scheduled for January 8th. There's a conflict, so we're going to have it rescheduled later in the month. As soon as we get a confirmed date, we'll send out information, and the information will also be found on our website. In February, we will feature a program co-sponsored by the Marin History Museum regarding the history of the original land grants during the Mexican era of rancheros during the period in Marin. The program is part of an associated exhibit at the history called Rancho Roots, California Legacy in Marin. So that should be a very interesting program. You can get information on our forthcoming programs on our website. And the website is marincoalition.org. And you can also find recordings of past programs available for viewing free on our archive page. Most of you know that the Marin Coalition is a 501c3 nonprofit community organization that exists to create what we term conversations that matter on topics of interest to the Marin community. This year will mark our 51st, or marks our 51st season. So we'd like to think that we made an impact on Marin over all those years. We rely heavily upon donations to fund our operation. We'd like you to support us and help ensure another 50 years of public affairs programming here in Marin. We encourage you to go to our website and make a donation. Also, most tables have this card on it, and there's information about making a donation on that card. There's also cards on the back table that you can stop by on your way out. And lastly, I want to thank and acknowledge board members Alan Shavitz, Alan's right there, for creating our recordings and handling our website and event registration. Pat Randolph and Stephen Keese. Stephen's there, and Pat is back there. And they've helped with the logistics of this program. Now on to today's program. Today's program is entitled, Who Can I Trust? Health Decision Making in the Era of Misinformation. To help guide us through this subject, our guest speaker is Dr. Matt Willis. Dr. Matt Willis served as Marin County's public health officer from 2013 to 2025, leading the county through numerous public health challenges, including the COVID-19 pandemic. A Marin native, Dr. Willis earned a medical degree from Temple University and a master's of public health from Harvard University, where he also completed his internal medicine residency. Before returning to his home county, he worked for the U.S. Centers of Disease Control and Prevention and in the U.S. Public Health Service, providing care and conducting public health work in underserved communities. In Marin, he co-founded RX Safe Marin, a nationally recognized initiative to combat opioid misuse, and became a trusted voice for evidence-based compassionate healthcare leadership. Dr. Willis continues to be active in community health and policy initiatives throughout Marin. He's a senior advisor and a regular contributor to your local epidemiologist. Perhaps we'll ask Matt to talk a little bit about that program. I'm a subscriber and it's a well worthwhile thing to be informed. So please welcome Dr. Matt Willis.
Thank you, Kevin. I'm gonna walk around.
Camera problem if you want that.
Oh, there's the camera. Okay. I'm stuck. Everyone, it's great to be here with you. I think this will be best as kind of a combination of the presentation I have and then also just a discussion. I kind of feel like we've been through a lot together as a community. And also wanted to have a chance to kind of revisit some of those shared experiences during the pandemic. And I'd love to hear your thoughts and questions. So I'm going to start with what's this? So what I'm doing now is dedicated to public health communications. And how I came to this was really through my experience in Marin. I recognize that, you know, over my 12 years. Let me see.
Yeah,
How about you?
get started. Should one. You got it. No, where's now? Where's the button next? Let me see. There you go.
There we go.
You gotta,
All right.
you gotta push the like button.
Yeah, there we go. The right side, I got it. Anyway, during my 12 years as health officer, I kind of recognized year after year, more and more that my primary role, my primary contribution to our community would be as a communicator, a physician, and an epidemiologist. And kind of early in the job, I was sort of focusing on outbreak investigations or counting cases of diseases, and really sort of in my office. And my boss at that time, who's here today, Dr. Larry Meredith, you know, encouraged me, along with many of you, to kind of recognize that public health was embedded in this sort of societal infrastructure of educators, law enforcement, elected leaders, and that really in Marin we had a unique opportunity to leverage that kind of that spirit of collaboration and the coalition of Marin to advance health. And so over time, I learned how to better engage across the community. And during the pandemic, I think that was sort of strongly manifest as the way we tackled the issue together. So just want to start by thanking all of you on behalf of public health and on behalf of the community as a whole. That I really think the any success we experienced during the pandemic was due to a sort of a foundation and a cultural expectation within Marin that I inherited and was able to sort of reflect and reinforce of a spirit of coming together to tackle problems that we're experiencing in an open, collaborative way. So that was a real privilege, and within that space, I think my role as a communicator was really kind of my primary asset. And that's why when I stepped away from the role as health officer last year, it's one of the things I've really been focusing on. And it's a really interesting time to be focusing on communications because things are changing so quickly, both in the way, just the information landscape with social media, et cetera. And then in public health, furthermore, the fact that public health itself right now is threatened and undermined by kind of federal and secular trends. But this is not new. So this is 1802. This is this is Jenner. So that's the man who invented the first vaccine. This was the smallpox. Smallpox was one of the leading causes of death, of infectious disease death at that time, all over the world. And he discovered that milkmaids did not develop smallpox. for some reason, just sort of on an like an epidemiologic observation. And it turned out because they were actually being infected with cowpox, which was a much milder disease, and it conferred immunity against smallpox. And so what he was able to do is actually inoculate, like purposely infect people with cowpox for a mild illness that would then permanently protect them from potentially fatal smallpox. So this is early 1800s, and there's the inoculum. It was literally like scratching someone's skin with the cowpox. And this is it's called The Wonderful Effects of the New Inoculation. And it's a political cartoon from London, 1802, published by the Anti-Vaccine Society. So as soon as we had vaccines, we had anti-vaccine. And you can see kind of, grotesque, like people basically are growing, parts of cows out of their bodies, and a lot, sort of a sense of obviously the sort of the fear and the concern that goes along with this, the possibility of side effects and government overreach, and concern about self-agency that now also still characterizes many of the anti-vax or the conversation around vaccines now. And also illustrates that for public health, we really do have two simultaneous roles. There's the role of getting people vaccinated and all the operations there. I know some of you with the NMRC, Bob, a lot of work together, getting the stuff out there and getting people vaccinated from an operational logistical standpoint. But there's this other piece, which is the framing of that work itself societally, and where does it land within people's beliefs as communicators. And one of the paradoxes that I found around public health, and Larry and I, talked about this a lot early on, is that the sound of like a public health win is like silence. It's a non-event because we're preventing stuff, and no one ever sees or feels what's prevented. And what we're facing right now, I think, almost is like an existential crisis in public health, because people do not defend what they do not see. And it's almost been like this badge of honor within public health to be like, oh, we're in the background saving lives, so no one even knows, like when's the last time anyone sort of praised their sewer system, but like sanitation was one of like the really most important public health developments, and saves lives and increases longevity, but it's kind of boring and hidden. And a lot of what we do is like that, right? I mean, now a lot of the anti-vaccine movement is characterized by people who don't see concern around things like polio, and don't want to choose not to be vaccinated, partly because they don't see those diseases, forgetting the reason we don't see those diseases is because of that vaccine work that happened. So there is sort of a crisis of invisibility. This was a PBS series called The Invisible Shield. Public health saved your life today and you didn't even know it. And so one of the things I'm doing as I communicate with public health leaders, one of my jobs now is helping advise California Department of Public Health, advise the CDC, in making the invisible visible. Like, how do we elevate what public health does, so that it is better supported? And into this, the new information landscape, I think, is increasingly complex, and it's hard for us as public health communicators to know even how to merge into this highway of information. And I think it's true for all of us as individuals. So this is the new information landscape. 90% of Americans now use social media. I did graduate from medical school in 2000, School of Public Health, and we had, stuff on communications. Public health communications was part of the curriculum in public health school. Not once was there anything on social media. It was a much more sort of old school approach to education, where you try and develop the best messages and then transmit them down to people who need that information. Kind of a very top-down and vertical paradigm of public health communication. It is now outdated. 90% of Americans use social media. And those are the different platforms that they use. When I did epidemic intelligence service at the CDC in 2010, still, there was no education on social media. So what you have is this cohort of people in leadership within public health that really don't understand the tools that everyone is using now to actually gain information. So there's a learning curve there. So as we see an increase in social media use, we're also seeing a declining trust in news media, especially recently. This is from Pew Research Center, and basically shows that there's been a real, I mean, sort of a general decline and then a much more rapid decline in the last year in both local and national news media. You know, CNN, CBS, all that are all seeing decreased viewers, and there's less trust. We're also seeing a declining trust in institutions. This is you know, scientists are still basically trusted. You know, that's about almost 90, you know, 90%, 80% say they trust scientists a great deal or a fair amount, but those numbers are declining. And as so much is happening now, there's a divide between the way Democrats and Republicans, these are, you know, across the nation, experience these things. And I'm not going to get into kind of the politics of that here, but it's just to acknowledge the fact that we all recognize this, that things are becoming increasingly polarized. And then I just thought this was an important trend to acknowledge. If you go back to like 1960, the percent of people who say they trust the government to do the right thing, just about always or most of the time, was about 80%. And it's like 20% now and even less. So there's just been this gradual and then precipitous decline. This one ends with Biden, and the current Trump administration, we see even lower numbers. So that's obviously a concerning trend. And then for me, as a public health, you know, leader and communicator, this is the one that's most concerning to me, which is that the declining trust in the CDC, because the CDC has been sort of the mothership of public health nationally. And it is really both Democrats and Republicans are seeing declining trust in the CDC. I've always referenced the CDC as sort of the gold standard. So like CDC recommends you get vaccinated, or CDC recommends you isolate, whatever it was, like you sort of like can pin it to what was established as a source of truth and trust. That is no longer the case. So now we're having to come up with alternative systems and alternative locus for trustworthy information than the CDC. So you might have seen that the Western states came together not too long ago, California, Oregon, Hawaii, Washington, to do their own like mini CDC, right? We're saying we're going to actually have our own research. So I'm just describing some of the trends in declining trust across what had been historical institutions of truth around science. And into that space now we have, with social media, wellness influencers. So people who are educating the public about medical decisions and science. And it looks like, you know, from this that the public really hasn't decided yet whether those sources are trustworthy. About half of the people who use, you know, most people do see get information from wellness influencers on social media. But about half of them say it's difficult or very difficult to know what to trust from those sources of information. And I think, you know, that resonates with me, you know, as I'm looking across at my kids, you know, because anyone now can just pick up a camera and start talking about something and post it on Instagram, and people read it. If they like it, they think it's true. So that's another, I think, concern, especially with young people. And this was an alarming finding to me, that young people are twice as likely to say the average person can know as much as a doctor. Like 45% of people aged 18 to 34 said that, you know, with a given like health issue, spend a little time on the internet, you can know just as much as a doctor. And of course, you know, my doctor friends, it's like, wow, you know, I spent 8 years in medical school, you know, training and trying to stay up to date with stuff. And, you know, people walk in the office and they're like, you know, think they might know more. And obviously the relationship with the patient is, we are working together collaboratively, and informed patients are obviously the goal. But at the same time, when there's sort of a questioning of the necessity of a medical education, or the value of medical education, that undermines, I think, our sort of understanding of the foundations of science, of science and medicine. So there's a paradox of more information is leading to less certainty. And I love this study. So I'm just talking about like how, how we're thinking about how we know what's true out there. This is a study that was done at MIT, which I love. It was 2018, so kind of earlier. But they basically had like a lie and a truth in terms of news, like something that was false and something that was true. And they just like released them out and then watched how they moved across like the social media landscape. And it was so clear that the falsehood just was way better at like moving through communities. And that B was the most interesting to me, which is that the falsehood reached 100,000 people, whereas the truth reached 1,000 people. That's a log scale there. So it went much further. It was retweeted. It was spread through peer-to-peer networks. It spread much faster, and it diffused more broadly. And stepping back, I don't know if any of you have read the book Nexus, but it's about like the way that human civilization, the information has traveled in human civilization over time. And this is borrowed from some of the insights that were offered in that book, which is the truth is like fundamentally disadvantaged when in a social media landscape versus a falsehood for these reasons. From a scientific standpoint, if we're trying to understand, like take the value of a vaccine or like the effectiveness of the vaccine, there's a rigor to that we inherit, the scientific method. It is a pain to actually go through that process. It takes time. There's a lot of research. The answers are often inconvenient. Like an N95 mask can prevent infection. That's no fun. No one wants to wear it, but that is an inconvenient truth. The truth is often incomplete and evolving. It's narrated by nerds like me, like science people, not like influencers. And it's held formally in institutions and medical journals. I mean, like a lot of the medical journals where these studies are conducted are behind paywalls. So it's not really open and available to the public in the same way, compared to a falsehood, which is engineered to attract followers. That's its only goal. It can be anything it wants to be. Anyone can invent a falsehood. They're often simple, they're attractive. There are multiple versions, so you can just pick your favorite falsehood. And they're narrated by influencers who are characterized by sort of their ability to manipulate and hyper charismatic. And they're held informally. There's no guardrails. It's not like they're, stuck in medical journals. So I think this is sort of what at the root of one of the biggest issues I think we're facing in science communications right now. And there's some just vivid examples of this. So what are the ways that we've been addressing? So working with the CDC and working with CDPH, California Department of Public Health, to just do more social media, like, oh, get your stuff out on social media. But this is an example of like how that doesn't necessarily solve the problem. This was like a Facebook post or a social media, comparing two different approaches during the H1N1 outbreak. 2 million views on the dairy industry doesn't want you to know about secret health enzymes. And then on the right, this story that basically is actually that pasteurization works, like gets the virus out of milk. But the poor guy, probably in a health department somewhere, like thought he was going to kill it. This headline, HTST pasteurization effectively inactivates, and it got like 52 shares. So it's not just a matter of like sticking it on social media. So we've got our work cut out for us. And this is just how I'm talking to some of the institutions of public health where when I came in as an epidemiologist, this is our goal, right? Is to describe and analyze so that we actually have the truth, right? And then you sort of leave it at the doorstep of society to sort of take that information. What we haven't been doing is telling the story, right? So we need to be better with it as scientists and as clinicians and in public health. We need to do better at telling that story. because science isn't finished until it's communicated. So here's just an example. You got scientists going apples, 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 and then you got the general public going, I think they said oranges, oranges, oranges. If you can't explain it, you don't understand it well enough. And that's Einstein. I'm just going to get into misinformation a little, and then we'll have to have a more open discussion. So there's been a lot of focus on misinformation. Misinformation, like examples, like the vaccine, the COVID vaccine has a microchip in it, or the other sources, or other kinds of misinformation. And if you asked me like 2 years ago when I was a health officer here in Marin, I would have said we need to focus more on misinformation. I now not so sure, because it is a whack-a-mole game. Like there is, for every one person that says there's a microchip, there's like 1,000 people, probably literally at least that, who have legitimate concerns and questions. And those nuggets of misinformation, those myths, are manifestations of deeper underlying concern and doubt, and we need to be working at that level. So this is the current model that I've been thinking about, and I learned a lot about this in Marin. Marin County had some of the lowest vaccination rates in the state in 2015, and now we have some of the highest. And I think part of that shift was to move from the top of that iceberg to the base of the iceberg, and actually recognize and respect the majority of people who might have real concerns and questions and doubts about the safety and efficacy of vaccine, rather than labeling people as being anti-scientific or dumb. I mean, words that words even as harsh as idiots and that kind of stuff. So this is what I recognize that we need to do a better job in engaging people who have different beliefs. And that's part of what I am now trying to work on the public health side, is to actually go ahead and engage MAHA movement and engage people who might be labeled as anti-vax directly. It doesn't work to sit in your echo chamber. And as a gesture, I mean, as an example of that, I accepted an invitation to have a debate with a guy named Jay Bhattacharya, who's now the head of the NIH. And he's been a lot, behind a lot of the changes in the federal level in terms of cutting budgets for science and that kind of stuff. And has been, is sort of seen as an enemy to the sort of the left leaning public health system and infrastructure, and is in fact threatening much of American science right now. But I was like the seventh, I think I was honored to be invited, until I realized that there's like the first string quarterback and second string and third string. I was the seventh person that Francis Collins asked, because the first six people were refused, as a sign of just the divide. Like wouldn't even sit down there to talk. I said, well, we might as well have the conversation. And it was a really good conversation. And obviously we did not agree on many things, but we at least acknowledged one another and heard one another and listened. And he got famous to the Great Barrington Declaration, which was essentially something that came out in October 2020 that said that we should be changing our whole paradigm for the pandemic response, and focusing on protecting older people and letting it rip through the rest of society. And the mistake we made, we speaking as a public health, was rather than allow that conversation to occur publicly and have enough confidence and humility to actually entertain that, the federal response was an email from Francis Collins to Tony Fauci that there needs to be a quick and devastating takedown. And what do you think happens with that? You think that works?
We're viral.
It backfired hard, because then you got Jay saying, hey, these guys don't even want to talk to me. And so in this conversation with Jay, we're acknowledging one another's experiences. And this is what I learned from him, is that he experienced perceived refusal to consider alternative views on the pandemic response. He felt he was dismissed, excluded, censored. These are the words he was using: shut down, blacklisted. And he had a point. And when I think about all that's happening right now federally at the CDC and the fact that we're basically programs are being cut, budgets are being cut. Vaccines are being basically eliminated from like lists of recommended vaccines. It's so confusing because it seems so antithetical to everything I've learned and understood about public health practice. But when I look back here and I understand the roots of some of that, it helps me actually see and have some empathy for where that many Americans are coming from, right? And it turns out 40% of Americans think there should have been fewer restrictions during the pandemic. So there really is a strong sentiment out there that public health overreached. And I think I and other public health leaders need to sort of recognize that as the next step, rather than just doubling down and communicating with our echo chamber over our value. And it's nuanced, obviously, because we also don't want to acknowledge misinformation. I'm just going to go. This is some of the lessons that I've been offering some of the health officers. I was down in San Diego yesterday, helping educate health leaders around how to actually engage communities differently. And I just want to share this one, which is, this is from the New Yorker. If you connect with measles, it spells my parents are idiots. And it's like, it is funny, but it's also mean. It's especially for people who might not have choose to, getting vaccinated because in their environment, they actually were, in fact, bona fide afraid of what the vaccine might do. And there's a lot of this kind of language, dumb, absurd, insane, etc. And that's never going to win people over. So another principle of gaining trustworthiness, I think, is obviously a person, a face, a credible voice, a consistent voice with a reliable cadence and structure. And that's one thing that I learned here in Marin with you all. And now we're going to get to kind of what we were, hopefully it was part of our shared experience here. And some of the things I learned from Dr. Meredith and others who preceded me, even Pat Kendall, that, we have to be working within these coalitions of intersectoral collaboration, especially when we're faced with a shared threat. So this is my life during the pandemic, was like Zoom meetings with different sectors. We had our hospitals and clinics, weekly meetings to all the hospitals and clinics, like 1,000 doctors, schools, big meetings with the schools, parents, principals, teachers, all our long-term care facilities, our volunteers, board of supervisors, and community response teams. We did daily public health status updates. I did over 1,000 public health status updates. I did over 200 videos, lots of press releases. We had a policy to just be open to media, any media, it didn't matter. Like conservative, like Fox News, whatever it was, we'll talk to them and get back to them within an hour. And then we established a website and social media. And this is one of the principles of public health communication that I learned worked in Marin, because there was an appetite for engagement, just like this coalition represents. Like Marin is a place where people want to step up to address issues when they come up. So when we set those tables, people came and they engaged, and it was positively reinforcing. But it's a way that we should be practicing all along. So that's the old model of information for public health, straight down. What we learned is that we need to work through coalitions, where the top is communicating to a network of trusted messengers who can actually who can get to communities, get to households themselves. And that's where you can have sort of bi-directional communication and actual respectful dialogue. And this is just our method for achieving that. I'm going to just fast forward through some of this because I want to get to the conversation. If there's one sort of mental model for how I'm thinking about public health communications now and how to address the problem of misinformation and technology, it's actually to go back rather than like jumping forward into the future with technology. It's going back to fundamental principles of human relationships and face-to-face conversations. That's going to be the best buffer against misinformation, because that's how we're made. So enabling that circle of people that they interact with on a regular basis to actually have reliable, trustworthy, and shared messaging around whatever the issue may be. Whether it's, fentanyl or, using Narcan for an overdose, whatever it might be, or vaccines. Recognizing that family has these natural interactions through the course of their day with trusted leaders, and making sure those trusted leaders, that they're teachers, they're pastors, they're librarians, whoever they see at their health clinic, their doctors, have the best information to share with them. And here's one of our best trusted messengers right here. This is Rhett Crowett. This kid is from Larkspur, yeah. And he I don't know if Larry, you remember this. This was his dad wrote an op-ed against me, basically, like back at the measles outbreak, because I wasn't closing schools when the measles outbreak happened. We hadn't had any measles cases. I wasn't gonna close schools. But his idea was that we should prevent kids from even coming to school so we wouldn't have an outbreak. So it's a reasonable idea. It's not evidence-based, not epidemiologic, but I reached out to him after he wrote it and I was like, can we talk? And it turned out his son had cancer, couldn't get vaccinated. He was worried for his son. And so I said, well, we're not going to close the schools, but why don't we have your son join us in communicating the value of vaccine? It's a great story. So Rhett joined me at the board of supervisors meetings. We pull up a little stool. I'd do my blah, blah, blah data stuff. And then Rhett would come and like stand up there, and within like 3 seconds, it's like drop the mic. Anything I had to say was so much less important than what he had to offer as someone with the lived experience. Right then, he's like, it's not fair for your unvaccinated child to be putting me at risk because I can't get vaccinated. And now Rhett, I just wrote a letter of recommendation for him for college. He's healthy. And there's him with Tony Fauci. He was honored by the White House or by Health and Human Services at that time as a public health champion. And here's another local messenger. So here's what I'm doing now, and then we'll get to. So this is it's your local epidemiologist. I'm writing a weekly public health newsletter, capture some of the principles I've talked about. I partnered with my friend and mentor, Dr. Caitlin Genelina, who was an epidemiologist in Texas when the outbreak started, when COVID started, rather the pandemic. And this is just an example of an email that she would write. This is like March 19th, 18th. This is like 2 days after we did the first shelter in place, which I was one of the authors of that first, what people call lockdown, with 6 other health officers in the Bay Area. And there was a lot of concern, obviously a lot of fear at that time. And so Caitlin would just start writing emails to her family and friends as an epidemiologist, and then would start forwarding them around. It was very basic, and it was signed "Love Caitlin." Like, here's what's happening now. Here's what I'm doing in my family, right? She had kids, she was pregnant. And it was kind of personal voice that would marry kind of the science with a relatability and a transparency around what we knew and didn't know. Someone said, instead of having to forward your emails, I'd love for you just to put it on Facebook and then we can all see it. So she started putting it on Facebook. It went completely viral. It became more seen than the CDC information that was coming out. So she really took off, and is now a Substack newsletter with she has about 400,000 subscribers. And she and I developed a friendship over the pandemic where we were sharing a lot of information because I shared many of her sort of the philosophy of communication. And so we started Your Local Epidemiologist edition for the state of California in August. And I'm the author of YLE California. And part of the rationale for that is that these, public health issues are really she has to look at the national view. So many of them are actually specific to the state. And the resources that are available to us, the epidemic, the diseases that are traveling happen at the state level. So that's me. I'm writing YLE California. It was launched in 2025. It's a little bit outside of my comfort zone in terms of just being kind of direct, like trying to be a little more influencer-y. Like I did one on Tuesday with my dog about she's a puppy, she's not fully vaccinated. So the message was like, when she's vaccinated, she's gonna have freedom to be able to go to the dog park, play with her friends, but she doesn't have that freedom now. So vaccines equal freedom was kind of the message, just as an example. So that's what I'm up to now. And you can subscribe there if you like. And there's I ended almost all my presentations during the pandemic to the board with that slide. That's my son at the Rosie the Riveter Museum. And he's now 15, he's at Archie Williams High School. And that always reminds me of the work we're doing, or not, it's not just for our generation, but for the generations that come. And I know you have lots of questions about how you might be finding reliable health information and any questions about the pandemic. So I'd love to just open it up to discussion.
If you have a question, raise your hand and I'll bring the microphone.
Yeah, Matt, that was really good. I didn't know about your debate with the author of the Barrington directive. And my recollection was that Barrington came out before there was a vaccine. Was that right? And so that was the initial advocacy for herd immunity. And if that would have run, through the United States the way it ran through some other countries, we would have had a lot more deaths, I would think, with that approach. And by holding off until there was a vaccine available, that prevented a lot of deaths. Is
Yeah,
that your impression?
yeah, I wish you had been there. No, you're right, and I think strategically, that would have been the way to have that conversation, right? Instead of trying to suppress it, and I think there was what was happening right now, there were things were moving so fast, there was so much concern about doubt, that the idea was just to put that idea to the side. In fact, had we had that conversation, that's exactly what we would have been able to reveal. That would have died on its own vine because it's a bad idea. And we would have, we don't have a vaccine yet. We're not gonna be able to achieve herd immunity. People are gonna die. There's no way to separate older people from younger people.
Yeah.
How does that even happen? So if I had been, able to call a shot, I would have said, let's have that conversation. And it would, again, it was a bad idea. It would be revealed to be a bad idea in the specifics. It makes sense, kind of, it's a nice idea on the surface, but the actual implementation societally would have been impossible. And unfortunately, we're not able to, we didn't have that conversation, but you're right. That would, because we didn't have the vaccine, if it had spread through the community that fast, there would have been so many more deaths.
I think I'm gonna get a bounce here, so I'm gonna try to block it maybe this way.
Hello.
Yeah, I think it was Mark Twain that said that it's much easier to fool somebody than it is to convince them later they've been fooled. I love it. So where do I get my information these days? If I've got an appointment with my doctor, before I even go in, I check with AI. See what my symptoms are, why am I getting up 4 times a night and having to go to the bathroom? This doesn't seem to be appropriate, what do you think, et cetera, et cetera. And it's a good source of information. What do you think the future of that is from your point of view as the healthcare provider?
Yeah. AI is another whole, like along with social media, AI is the other sort of trend in information that is clouding truth. I'm actually, one of my other jobs is working with using artificial intelligence to model the health effects of climate change, and I'm building AI systems. So I see very clearly the limitations of those systems. They create an illusion, very powerful illusion of truth and competence, because they're so semantically on it, and it's so professional appearing. So I am confused. I'm confused like all of us, but I'm also concerned around the premature reliance upon AI for medical decision making. I do think it can be useful. I mean, from just a practical use standpoint, to if you have an established like Claude or Chat GPT, like an established large language model for a very basic question, can guide you to a narrower set of parameters, like can guide your decision making to what to bring to your provider. So how to organize that conversation with your medical provider in a way that would not have occurred without that kind of support. So I think that's the way, the safest way and the most useful way to use AI now is to narrow the sort of the differential diagnosis, or to offer, you could even phrase it to say, what should I talk to my doctor about? These are my conditions, these are my symptoms, rather than say, what treatment should I be going for, or something that would actually potentially lead to harm if the AI was misdiagnosing, which it can easily do. And it's out of the bag. There's no way that we're not gonna, I mean, half of young people think they can know more than their doctor just off the bat. So it's more, I think, a matter of just making sure, rather than sort of not using it. I mean, the message to like stop using AI is never gonna work. It's a matter of understanding its strengths and limitations so that people can be informed users. And I think that's probably right now, we're getting medical information. It's being curious about something and also being skeptical about the answers and making sure it's run by an expert human being before you take action.
Another question.
Matt, you covered a lot of ground in your talk. I was brought up in New Zealand in the public school system there, and we had very good teachers and were always taught or encouraged to be curious and to ask questions. Doesn't matter what the subject is, much to the chagrin of our parents from time to time. I'm a geologist. Amongst other things, I've studied the history of climate of the planet for billions of, or millions and billions of years. I give talks on climate now and again. There's a lot of shonky science out there in the public forum on climate, and one of my concerns is that a lot of the kids today in our public school system here, and I've lived in the States for 50 years, are not taught the same sort of approach to life as I went through. And the media, you mentioned the trust in the media going down, because these days they seem to parrot everything rather than do really good, genuine, investigative reporting. Would you care to comment on that?
I think I have a 15-year-old son, and I do not envy where he sits right now in terms of trying to sift through. I mean, it's related. In my newsletter today, there was a new Governor Newsom just signed a bill that is going to put safety warnings on social media for young people. If you're under 18, it's going to say, we know social media can be harmful to your health, and when you first log on, and every 3 hours, there's going to be another 30-second non-skippable thing. So I think that's an example of the fact that we're trying to now find ways, some guardrails on sort of the ways in which information is reaching our young people and informing them. I think when it comes, I mean, climate has a lot in common with vaccines, polarized conversations. And I don't know, I think, again, to me, we have to get back to trusted messengers and ensuring that we as scientists who are actually rooted in kind of the rigor of history around how we describe these issues and how we know what we know, have access to and trusted relationships with people who can actually be face-to-face conversations with our kids and with society. So, our teachers, our doctors, I mean, there are still trusted people in society. And I think those to me, I mean, and this is all very subjective, right? Because I don't know that anyone's figured this out. My belief, based on my experiences as a health officer in Marin, where there's relationships matter a lot, is that the solution really is ensuring that we have access to those networks of trusted messengers across the community who can actually have real conversations with our kids about what's right and what's real and what isn't.
I have kind of a two-part question, and part of it is I'm very pleased with Marin counties. I'm with Kaiser. I love them. I think they're wonderful. I think they're ahead of the game. But I wonder, in our country, my older brother wanted to get a COVID vaccine. He lives in Florida. It was hard. I mean, he's a veteran. He went to the Veterans Administration. They didn't have enough. And you read about the measles epidemic in Texas. Does that affect anybody to think twice about, well, it's not happening in California, but it's happening in this location. Because we can be comfortable here, but I look at the whole country and we have such diverse opinions. How do you start to try to address that?
Yeah, I mean, I recognized even more, you know, Marin, I had, because of our success, we had an objective success during the pandemic. We had some of the lowest mortality rates in the nation. We had some of the highest vaccination rates in the nation. We had some of the least closed infrastructure in schools. We opened our schools. We were the first to open schools, public schools in the state. So it offered me a chance to sort of travel elsewhere to tell our story. And it became very clear to me pretty early on that I had it easy. I mean, in some ways, that like some of our success was attributable to the community as a whole, right? One is that we are by and large a relatively healthy community, just in terms of our physical, longevity. And that culturally there's an adherence and a belief in science. And people were actually looking to me for guidance and expertise. And I honored that relationship bidirectionally by being transparent and frequent communications. That was an exceptional set of circumstances that in other places the health officers never even got in the door. So like easy for you to say, Dr. Willis, I couldn't, no one wants to listen to me. So I don't know I don't know the answer to that. I think we are, California does have, some pockets where there's some of those themes as well. And I think there's an opportunity for us to sort of, and that's probably that's part of what I'm doing in California, is reaching out to some of our more conservative, like rural northern counties, and have new conversations where you hear from people. And I'm still just always struck by the power of like a real conversation, like a real person. Because when you look at it from a distance, it just seems like, especially framed through the media, like we're idiots to them, they're idiots to us, and we don't make any progress. Yeah, sorry.
Yeah.
Sorry.
You talk about trusted messengers and whether AI is there yet or whether it ever will be. Three sources that I use are Wikipedia and WebMD and Mayo Clinic. Could you do you have an opinion on any of those three as sources of information? And are there others that you would recommend as accessible, unbiased sources?
Yeah. Mayo Clinic. So I think who can you trust? I think your clinicians you can trust. Like your doctors and nurses are trustworthy, and the institutions that they tie to, like Mayo Clinic. So I think almost any like health system is probably, for me, like Kaiser, because they marry scientific rigor with they're basically not as influenced by politics as as even public health departments. A lot of public health departments now are more influenced by the political environment, whereas our health system. So I like Mayo. It's great. UCSF, has some great information. Harvard, Stanford, some of those just like well-established large health systems that are focused on communications are still super reliable. And then the one on relationship with your doctor, I would trust your doc or the nurse, like, because I've been,
It's easier to type in.
it's totally easier, and you can't reach your doc, right?
Yeah, sometimes you get the conversation with the doctor before you do that, you can go to WebMD.
Yeah.
Clinic, so those are the sources.
I like Mayo more than Wikipedia. I mean, Mayo is better than, I think Wikipedia is probably more fickle and more prone to sort of idiosyncratic input compared to something that's like vetted by clinicians and is rigorous like Mayo.
Thank you for your talk today, and thank you for everything you've done as public health director. It's probably an understatement to say that culture is a very hard thing to change, and I can only imagine the uphill battle that public health has in today's environment to kind of find and communicate truth. when I think of maybe the most important change of public attitude regarding health in my lifetime, I think of the dramatic change in attitudes from the 50s and 60s to today about smoking. So my question is, are there any lessons that we can learn, other than having major lawsuits, or maybe that's the answer, but are there any lessons we can learn from that win, or perhaps there are other wins that you can think of that can help us take a mega step in the right direction and try to turn this battleship around?
Yeah. I think that the tobacco experience is a wonderful example in so many ways of like how to get things, turn something that's terrible into something that's less terrible. And from a sort of a population health standpoint, this is something that Dr. Meredith, I think, spent a lot of time working on with the tobacco. I mean, to me, the one is to recognize that the corporate influence is so strong that there needs to be relatively radical resistance, right? We did not hold back on big tobacco. It was like a battle, right? It wasn't polite. And we recognized there was an enemy there to the health of the people because there's so much money to be made in the lobby. It's like, so that's one, I think it's not equivocate in that way. The other is that there was a power kind of on the other end of the spectrum, a power in sort of the community responsibility aspect of this. This is something that we leveraged in Marin. You saw the example from Brett Crowley. Secondhand smoke, right? It's not okay for the person smoking next to you to put you at risk. So you're basically, through the information you're providing to the population as a whole, of their risk of secondhand smoke exposure, there becomes much stronger peer-to-peer pressure, which people respond to. And elected leaders have to respond to when you got the majority of people saying, listen, I don't smoke, but I don't want to get lung cancer either, because this guy's smoking. You need to protect me. Those are powerful messages for elected leaders to start at least putting up smoking, no smoking signs or like no smoking area, and then progressively want stronger and stronger policies. So I think that was another parallel, was the invocation of community responsibility that we've applied successfully to vaccines.
Yes, sorry. First, I want to say thank you for your leadership during the pandemic. I personally would access your videos. I sent them to friends. I used them to inform me and my family, and they were really invaluable. So thank you so much.
Thank you.
I'm curious to know about the coalition of 4 states, the California, Oregon, Washington, Hawaii, what the status is of those. That's the first part of my question. The second part, you haven't talked too much about the pharmaceutical industry. I'm just curious how you're holding all that. Speaking of big, powerful. So those are my 2 questions.
The coalition, just in terms of the West Coast coalition. Yeah, I mean, that coalition formed, this is one of my concerns around the future of public health, honestly. I worked at the CDC, kind of, almost every nation has like a national public health system. What we are moving towards is a highly federated kaleidoscope of public health practice across the United States, especially if trust in the CDC is undermined like we saw. And so the Western states are sort of politically aligned. They're going to go together and do their thing. And then you got Florida now doing their thing, right? Florida's no longer going to require vaccines. There's another coalition forming in the Northeast. It will become a mess. I mean, it is important. So I have two views on this. One is that, yes, thank goodness for California, we now have the Western states, the Western Coast Coalition that can actually have policies. I mean, it's not just symbolic. There are now policies through that coalition that require insurers to cover vaccines that the ACIP, the CDC, may not recommend, which is new. The problem is the aggregate of that over time is it's just we're going to lose a cohesive, singular public health system as a nation. So I'm hoping that this is like a placeholder, that we're going to be able to get through this and then reinstitute sort of that those things can reintegrate into a singular bubble again of the country as a whole. And the mechanics of that are still being worked out, like who's regulating the Western code, like who is it like self-governance, it's like there's no oversight over that group federally. And the other question was oh, yeah, I mean, I think the pharmaceutical industry, we do need to keep an eye on. I mean, I mean, just generally my thought, any place where there's so much money to be made, you're going to have to really keep a close eye and regulate the heck out of it. And that's why the importance of these independent panels is so important, like ACIP. You know, I mean, I had a chance to speak to some of the groups nationally, the National Vaccine Advisory Committee. And there are people who come from all over the country, a lot of from like academia or from healthcare providers who are experts, not pharmaceutically connected at all. And they truly do independently review all the information coming from the clinical trials, et cetera, to make an unbiased determination of the value and the safety and efficacy. And those processes are so important because, of course, it left to their own devices, the manufacturer will say it's God's gift, you know, like, and so and those structures do exist. And I'm concerned that those are being undermined. Like RFK just fired everyone on the National Vaccine Advisory Group and replaced them with his own people, right? So it's like, that's not the solution. Because now they're saying that no vaccine, right? They're like anti. So I think we need to get back to that. The system worked. And I think we need to get back to that.
Do you think our scientists and I'm sorry, do you think our scientists and the people who have been at the CDC, and there's so many who have been put aside because of their financial grants going away and things like that, do you think they're still out there and hanging on to a point where, so that if we can get back to a place where we want to be, that they're gonna be back to work and we can make up for some of this and they're not just sitting, losing all hope?
Yeah, that is such a great question, and I think that is not the case. Unfortunately, I mean, I think it's to some degree, but I think the enduring legacy of this, even temporary interval of undermining science, will be that our scientists leave. I mean, other countries are on it. They're like, come,
Yeah.
sure. Oh my God, yeah, we have a home for you because you're a freaking kick-ass, whatever, immunologist. It's so stupid to like, but that, so that's, and then on, LinkedIn, like, they're like open for work is like a little tag you put on your LinkedIn profile. It's so sad. I'm seeing all these like old friends who are like amazing scientists. They were like on their LinkedIn profile says they're open for work. And they're just trying to, so they will be pulled into whatever other alternative. So yeah, I do worry that we're not, that we're gonna lose the brain trust a little bit there.
Hi, I too want to thank you so much for the videos during the pandemic, and also the data on the website, the county, that still exists about the various infections and coming from the sewage. I look at it and I looked at it and I looked at it, and it was really impressive to see. Because I think that our country, we're not exposed to lots of things in the rest of the world. You look at water. I mean, we can drink water out of the tap, but you go to other countries where people can't, even very developed countries. And I think that I think the same goes for a lot of what you discussed. I think that in communicating with people here, there are a lot of different categories of people who live here. And I think to communicate is a big part is understanding who those people are. and for me, I try to understand who are the anti-vaxxers, because I have, for example, okay, I just cannot believe that people actually believe half of this stuff, the baloney that's served, and yet people do believe, and they think that educated people or science is something very elite, or they have mistrust. And so how to interact and communicate with people that either believe that nonsense. So anyway, it's I'm sure that I have a feeling that maybe that's something that you do discuss or discuss.
Yeah.
Also, thank you.
Yeah, well, thank you. I'm first of all thrilled to hear that you actually looked at the data, like the wastewater stuff. I mean, that was like one of the hidden strengths of our pandemic response was the data. Like, we had a great team of epidemiologists. Our hospitals, we only have 3 hospitals, so you can have direct relations, like we need the data. So we set up these like internal surveillance systems way before the state did. And then I reached out to Jason Dow over here at the Marine Sanitarium, like, I hear that we can start looking in the sewage for like virus. He's like, sure. They're like, how are we gonna make this? And it was like very homespun, but we were like one of the first to do like wastewater stuff. And as a very Marin County thing. And the Board of Supervisors supported it. I just felt very privileged to have that, so those sorts of opportunities to innovate. And getting that data out there was invaluable to us in actually seeing where the vaccines were happening, where the virus is flowing, where it wasn't. And putting that out to the public to see and participate as learners with us was critical. So I love hearing that people actually looked at it. In terms of just meeting people where they are, one just quick anecdote was our first approach when we saw low vaccine rates. I had been, I came to Marin County 2012, became health officer 2013. I couldn't believe that we had like such low vaccination rates. Because I was like, wow, I've been working in Haiti, and I was like, they're like the same vaccine rates, like for very different reasons. Those guys didn't have access to vaccines. Here it's like every option, but it's a choice. So there was like this whole like brain, like trying to figure it out. The first thing we did was actually just meet, right? So the instinct, which I think ended up being the right instinct, was to talk to people, to just and serve. We did surveys, we did town hall forums, and we learned. And immediately I learned that like they're not anti-vax, right? They're not anti, because most of the people who are choosing to opt out of some vaccines are choosing to opt into some also. So it is not anti-vax. Like you don't want the MMR shot, but you're getting the flu shot or whatever. It's like, so it's not anti-vax. It's like there's a whole nother. So there was some of that, like almost like semantic clarification and how to categorize people. And it was actually agnostic. Like there was like, or hesitant. It was a much more seeing people on the fence rather than on the other side of the fence. And having the conversation, we had much, it wasn't as, we didn't have to go as far as I thought we did to get higher vaccination rates, because most people who were opting out of all the vaccines, like if they didn't want all the, they would at least want some. Just an example of the fact that like being much more nuanced in how you classify people. And the only way you can get that nuance is through those real conversations, and then you can meet them where they are. And that was true in a little microcosm of Marin, but it's probably even more necessary now nationally.
So thank you very much. And during the COVID, that period, a couple of years, and we saw your information. There's actually a Facebook group in Marin County that follows coronavirus. And it's very popular Facebook. And they discuss issues and conversations and have a lot of information. And I would take your information weekly and I have my own table share with my friends. And the comfort, I think the comfort in the constant communication of facts really make them feel good about the situation because they're not scared, they know what's going on. So that it's really great. That's just my comment. And I also talking about the sewage. Rotary does polio vaccination, and they do go around the world. They check on the sewage and to check on where where the polio might be coming back, and which it is now, unfortunately. My question really is, I heard people say, oh, other countries are not as advanced as United States. On the contrary, though, I think some of the countries are actually a lot more advanced than United States. Even like, Taiwan, their public health and, their, how they can help low cost and be able to do that. So how can we get some of the knowledge back to the US, especially with the last couple of years, they were losing that? So how do we, I mean, we still have the top scientists, but just.
Yeah.
You know what I'm trying to get
Yeah,
to?
sure.
Thank
Yeah,
you.
Well, first of all, just your example of Facebook is such a nice example of that trusted messenger net. Like, so I'm getting information to you. And then you're presenting that information to a cohort of people that trust you. Right? So that's that sort of representative model that I see as sort of the necessary future of comms. In terms of the global stuff, I mean, I almost feel like that's a cultural problem with, in the United States. I sort of think of it as the only place when, and that's, my mother was French and I grew up in a very, so I have a much more global, just natural view. And I worked in Africa for a while and I just kind of, and I kind of recognize the rigor that people apply everywhere in the world to the same problems. And so we actually looked very early on that globally. Like I was looking at what was happening in Denmark. Part of what empowered us to open schools more early was what was happening in Scandinavia. And I almost felt like I, wasn't sure how much I should be sharing that my data sources are foreign. But you trust that science, right? And when we did the first drive-through, I don't even remember, drive-through testing at the Civic Center, where you could drive through. And that was the first one in California. And that was a model from Korea. So Korea was doing drive-through, and why, if it works there, why we can at least try it. So I think we accelerate so much more quickly when we recognize that there's best practices happening all around the world. And there's a cultural bias, I think, in the United States not to look to those things, and that's been a problem.
I want to add my thanks for your stellar leadership in this area and in an increasingly unstable time when no one could have brought stability back, you at least made things less unstable. And I particularly like this talk because I've never heard one probably before on who do you trust. And I particularly like what you said 10 minutes ago about trust clinicians and doctors and the institutions they're associated with. And what you didn't quite say, but I think you were getting there, was that as you move into politics, maybe it's a little less trustworthy. But you also said about 5-10 minutes ago that corporations are a major problem, and maybe we need politics to fight the corporations sometimes. But what I really want to ask about is RFK Jr. I'm surprised you didn't mention him. He's such an anomaly. I can't figure him out. I mean, he's a scion of such a Democratic family, and nobody's surprised he's running for president or something. And nobody in his family supports him because he has this core anti-vaccine thing that I think Democrats tend to be inherently supportive of vaccines. And perhaps I should say it more accurately, as you suggested. Republicans and conservatives, it's not that they're anti-vaccine so much as anti-government, fearful of government. I mean, some people come to the doctor and say, oh, more vaccines, fine, load her up. Others say, well, what is it? Why should I take this? What's the advantage and the disadvantage? What are side effects? Are you sure you're not trying to trick me? That's where they get a little paranoid. But tell me about RFK Jr. What's up with that? And my final capper to this is Trump is so quick to dismantle whole areas of the government. I too, like you, am scared when I see the graph about the lack of faith in the public health system. If that goes off a cliff, wouldn't Trump be likely to say, well, fine, that's going off a cliff anyway, cut the whole thing out? And who would be better to do that than RFK Jr.?
Yeah. No, I do think that a lot of folks in the public health sector right now are feeling that fear, like that there's an existential concern around public health as a thing, like as a field, especially in certain parts of the country. And that RFK he's made no bones about the fact that he's not a fan of public health, like as a sector. I don't, I've been asked this question, like, what's up with RFK? And I feel like I should have a better answer. But the honest answer, I don't fully understand how a guy. I mean, it's okay that, there's a lot of people with wacky beliefs out there, and it's part of these conversations around vaccine hesitancy and bringing everyone along and meeting people where they are. And, even within Marin, we had a lot of people with what I would call fringe beliefs about different health issues. But for someone who represents that to actually accelerate to the very top of the entire science system within the United States, which is the largest, most robust scientific research of any nation, right? We have more science infrastructure in the United States than any other country. We are leaders, literally, of the entire planet. And for that person to end up on top of that is a complete mystery to me. And I think it is partly, the roots of that are partly an inheritance of what I was discussing when I addressed Dr. Bhattacharya, and the way in which there was a sense among many that they were being disregarded and unheard and unseen in their concerns. And that was a product of, I think, a style of public health leadership that is understandable given the constraints of the pandemic. There were lives, like millions of lives at stake. Things were cut back, and very quickly there was a lot of uncertainty. So I think we have to forgive some of that, perhaps more autocratic approach to the pandemic. But as an inheritance of that, I think there was an appetite for rogue players who identified primarily against that, right? I mean, if you remember, it's hard to know what, I mean, if you asked him like what he's for, it was like vitamin A for these, like so much of the narrative is just not that. Like, we hate those guys, right? We don't like what they did. And unfortunately, there was enough, I think, appeal to that negative argument. I mean, that's what the president is also invoking all the time. And I think, some of the learning on our end is to sort of recognize that there might be some understandable roots for that enemy that's levied in this way. I'm hoping that he will, that the sort of idiosyncratic or fringe nature of his belief system will eventually lead everyone to sort of see that he should no longer be given the power and the authority that he has, that he's going to be his worst enemy at some point. He's just going to go too far. And I think that's happening. I think we're starting to see that that's happening. I think people are recognizing that he's not an effective leader over all the agencies that he's supposed to. I mean, he might be okay as sort of an influencer, but not as a government leader. And I'm offering, what I do as a communicator is try and make linkages. I try and help people make the link between this set of beliefs and what that would mean for us as a community. Let's play this forward. Like if he says we should be using vitamin A for measles rather than a vaccine, let's play this forward. What would that mean? Right? And you can actually do some math to say, oh, this is the number of deaths that would occur if we invoke that strategy. So trying to sort of play follow and like actually react to and respond to some of the misinformation that he's spreading so that people can actually see what's at stake.
You mentioned that we should talk to our doctors or healthcare providers if we have a question. Unfortunately, the barricades that we run into, the time, the difficulty of setting up an appointment and then going to be there, or going through the internet through a portal. We can't use email, we can't use text messaging. And a phone call usually ends us up with an answering, somebody working from
Robot.
home,
Or,
passing a message on, and we might hear something later. Most of us are most receptive to information when we have a question about it, and we go to a doctor and ask a question. And the internet and AI might be what science or technology is using to fill that sort of gap that I was just talking about. I wonder if there's some way that you and others who are both the communicators of and sort of the custodians of real science and real information can work with the developers of the AI systems to help make sure that when people around here, we go in and do our own research, because at 10 o'clock at night, that's what we're worried about. Um, make sure that the information is accurate.
Well, there's, AI is, paradoxically, I think AI in its best form will actually open up new channels for human communication, real human communication, by unburdening doctors from the scut that they normally have to do, right? Like, I mean, as a physician, like, if you're seeing 20 patients a day and you've got to do all the documentation, you've got it, like, you just don't have time for, or even like spirit energy for like fielding calls, after, like, because it's already 8 o'clock, you haven't gotten home for dinner, and like, I mean, the experience of the physicians, we need to have some empathy for that, right? When you can't reach them. AI is helping with a lot of that, with like more automated documentation and internal processes in health systems that are allowing doctors to actually have more time. So I do think there's a way in which AI might actually make those calls, you might actually reach a physician more frequently because they're not burdened with some other stuff. And then the other part of the question is just what I've been doing for climate is curating content for AI engines. So what I'm doing is ensuring that the information they learn off of is good information, and that they do not see other things. So there are these bespoke, if you will, silos of reliable data and information that the AI engine will learn from. And I think that's the future of AI with regards to health, rather than having them go across these LLMs, large language models, where they're just looking at everything on the internet and then trying to figure out what's meaningful and what isn't. The likelihood that some of what comes in is corrupt is much higher than these more curated, expert, human in the loop, curated systems, where the AI has only seen what you fed it. And you're looking through using your subject matter expertise to look through the corpus of peer-reviewed literature and reports in science, so that when it offers an answer, it's only referencing those things that you've already vetted. And there are tools like that, and that's like Kaiser uses. That's, I think, sort of next year and 2 years from now, that's going to be sort of the primary way in which health information is going to be offered to the public.
These are all great questions. We have time for one more. Does anyone have a question? Oh. Okay. Did you ask the question before? I wanted to get.
This one over here was raising her hand.
Okay. Who?
Oh.
Carol.
I'm wondering about the medical schools around the country. I happen to know that Baylor in Houston, their president does a weekly talk that was very, very similar to what I then found that you did all during the pandemic, but he's kept it up. And it's about 10 minutes. He talks about what's in the sewage. He will review studies. He reviewed the study of how the Tylenol thing came. That study, there's no way to know whether those children were even given Tylenol.
Yeah.
It wasn't even part of the study. So I just wonder, are other medical schools doing that? Because
That's great.
That's
Yeah,
great.
I think Peter Hotez. That might be Peter Hotez down there at Baylor. I don't know of other medical schools that are doing that, but that's, I think, exactly what I'm trying to also do and have been doing is translation, essentially. Like, basic translation. You know, something between like the randomness of like an influencer that may not, and then the sort of the overly structured and slow infrastructure of like traditional public health science and academia, where it might be a month before you get an answer to the question because they had to like look it up and vet it 1,000 times, all that. There's something in between there where there's an individual, and then it also capitalizes on the fact that people like to get to know someone and that relationship. And one of the things I've learned, I mean, during the pandemic, we were doing video, like I was making videos, and you have a sense that you're speaking to your community, but you don't have it. But since then, as I go around, people will recognize me as someone that helped them through the pandemic in some way through videos. And it's sort of is an illustration of the way we think as people. It's like we like to learn from someone that we know and we trust, and we learn from that person. And that's like a style of communication that I think is just evolving, like what he's doing, right? Because he might have a dog, right? Bring a dog, exactly. And I don't feel like that. There's nothing particularly special about, I felt like my willingness to just try that was stronger. I mean, more of a strength than sort of any natural skill. But it was like just kind of recognize, and I think there's more. That's part of what I'm trying to encourage other health officers to do and model in this newsletter.
So on behalf of the Marin Coalition, I want to thank Dr. Willis for a great talk. We'll look forward to, I want to remind people about our next event on December 11th. With the executive officer of LAFCO, so we'll look forward to seeing you then. Have a pleasant afternoon.